Disaster can occur anywhere, anytime. Our awareness and alertness can help save lives of millions of people and prevent physical disabilities in the absence of timely professional help. First aid is the initial assistance or treatment given to a casualty for any injury or sudden illness before the arrival of an ambulance, doctor or professional medical help. Timely first aid can preserve life, limit the effects of the condition, and provide immediate recovery from injuries.
हेलो, अल्फा चार्ली 2 ऐसा है संसद भवन के पास एक इमरजेंसी है, उसे लेके हम आरएमएल हॉस्पिटल जा रहे हैं.
In case of an emergency, one should immediately summon help. First aid measures can then be initiated, depending on the circumstances. First aid could be given by a trained person who knows the right techniques and can remain calm during emergencies. First aid can be used for emergencies such as breathing and airway obstruction, cardiopulmonary resuscitation, wounds and bleeding, fracture, head injury, spinal injury and sprain, burns and shock, snake bites and heat stroke. A volunteer must remember D, R, A, B, C as the action plan for giving first aid. D is for danger, R is for response, A is for airway, B is for breathing and C is for circulation. Let's begin with the action plan of handling an emergency. Step 1. Assess the accident scene. Ask someone to call for medical assistance.
Hello ambulance? Yes. आरबीआई के जस्ट साथ एक एक्सीडेंट हुआ है, सीरियस एक्सीडेंट है. हाँ, कोई गाड़ी वाला मार गया उसे. हाँ जी. ठीक है. Yes, yes. जस्ट आरबीआई के साथ.
Before providing first aid, make sure the casualty, you and any bystanders are safe. Step 2. Assess the casualty. Check the casualty for a response and conscious state. Gently shake the shoulders and ask loudly, "Are you all right?"
Hello. क्या नाम है
Try
आपका?
talking to the casualty
आप कहाँ रहते हैं?
and check for any identification and contact details.
कहाँ रहते हैं आप?
Reassess the casualty from head to toe to determine any vital signs of injury, consciousness, breathing, pulse, and skin color. Step 3. Check the airway and breathing condition of the casualty. Gently tilt the head back. Check the casualty's breathing and the mouth for any obstruction. If there is any obstruction in the casualty's airway, then open the mouth and scoop the material out. Keeping the airway open, look, listen, and feel for normal breathing for no more than 10 seconds. Look for chest movement. Listen for breaths at the casualty's mouth. Feel for air on your cheek. Step 4. If the casualty is not breathing normally, give rescue breaths. Tilt the head of the casualty and place a filter on his mouth. Take a normal breath and place your lips around the casualty's mouth, ensuring a good seal. blow steadily into the mouth and watch for the chest to rise and fall. Give a total of 2 effective rescue breaths. Check the pulse. Step 5. Check the casualty's circulation. The volunteer could render cardiopulmonary resuscitation to the casualty only if the casualty's heartbeat or breathing has stopped. Combine chest compression with rescue breaths if rescue breaths alone do not make the chest rise as in normal breathing. If required, one could open the upper clothing. Place the heel of one hand in the center of the casualty's chest. Place the heel of your other hand on top of the first hand and interlock the fingers. Position yourself above the casualty's chest and with your arms straight, press down on the sternum to achieve the full compression depth of 4 to 5 centimeters.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Do not apply pressure on the ribs, upper abdomen, or the bottom end of the sternum. Wait for the chest to recoil after each compression. After 30 compressions, open the airway by giving 2 rescue breaths, maintaining the head tilt. Continue with chest compressions and rescue breaths in a ratio of 30:2. Do not interrupt resuscitation till breathing is normal. Cardiopulmonary resuscitation for children. In case the victim is a child, remove any obstruction from the mouth. Check the pulse, tilt the casualty's head, and check the breathing. Give 5 initial rescue breaths before starting chest compressions. Check pulse and breathing again. If not breathing, open the upper clothing and start chest compressions. Give 30 compressions using one or both hands for a child as needed to achieve an adequate depth of compression.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Compress the chest by approximately 1/3 of its depth.
3, 4, 5.
Allow the chest to recoil completely after each compression. Give 2 rescue breaths. Take approximately the same amount of time for compression and relaxation. In case of an infant under 1 year of age, use 2 fingers for compressions in the ratio of 30:2.
17, 18, 19, 20.
Compression rate refers to the speed at which compressions are given, not the total number delivered in each minute. If you are unable or unwilling to give rescue breaths, continue with just chest compressions.
1, 2, 3, 4, 5, 6, 7, 8.
After the action plan, place the victim in a recovery position. Kneel beside the casualty. Place the casualty in a lateral position with his legs straight. Place the back of the farther hand of the casualty against his cheek. Place his nearer arm straight or at right angles to the body. Roll the casualty onto the side by pulling the farther leg towards you. Bend the upper leg from the knee at a right angle. Tilt the head to make sure the airway remains open. Adjust the hand under the cheek. If the casualty has to be kept in the recovery position for more than 30 minutes, turn him to the opposite side to relieve the pressure on his lower arm. For infants, the recovery position should be done carefully. Cradle the infant in your forearms with the head slightly tilted sideways and sloping downwards. Support the head and back with your forearms.
Cough, cough, cough.
A volunteer must recognize choking and airway obstruction by a foreign body. One must not confuse the signs with fainting, heart attack, seizure, or other conditions causing sudden respiratory distress, cyanosis, or loss of consciousness. Foreign bodies may cause mild or severe airway obstruction. In case of choking and mild airway obstruction, encourage the casualty to cough out the obstruction.
Cough, cough, cough.
In case of severe choking, stand to the side of the casualty. Support his chest with one hand and lean him forward. Give up to 5 sharp blows between his shoulder blades with the heel of your palm. Check to see if the object has come out.
All right? All right?
If 5 back blows fail to relieve the airway obstruction, give up to 5 abdominal thrusts. Stand behind the casualty. Clench your fist and place it between the navel and the bottom end of the sternum. Grasp the fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times, alternating with 5 back blows. If the casualty becomes unconscious, support the casualty carefully to the ground. Begin cardiopulmonary resuscitation. Abdominal thrusts can cause serious internal injuries. Casualty receiving abdominal thrusts require medical aid. If first aid is not given in time for excessive bleeding, it may lead to infections, complications, and in certain cases, even death. In case of bleeding, raise and support the injured part by raising it above the heart level. Cover the wound with a sterile dressing and apply firm pressure to it. Bandage the wound firmly. Apply another dressing if bleeding continues. If the bleeding continues after the second dressing, remove both the dressings and apply a fresh dressing. Ensure the pressure is applied accurately to the point of bleeding. In case of a foreign body, such as glass in the wound, raise the injured part and support it while maintaining pressure sideways. Place a ring pad around the wound and cover it with a bandage. If any body part has been severed, put it in a clean and dry plastic bag. Place it in ice indirectly. You must immediately send the body part with the casualty to the hospital for treatment. Mild to moderate bleeding from cuts and scrapes could be stopped if washed and dressed firmly. A fracture always necessitates attention of a doctor. Immediate first aid can protect the bone and the rest of the body from further damage. In case of a simple fracture, immediately immobilize the injured area by supporting the limb. Place padding along the injured limb. Pass broad bandages above and below the fracture under the natural hollows of the body to prevent movement in the joints. Tie a sling around the neck and support the limb on the sling. In case there is an open fracture with bleeding, make the casualty lie down. Remove any clothing covering the wound without pushing the injured bone. Clean the area around the wound. Put sterile dressing and place a ring pad around the wound. Cover it with a bandage. Place padding between the legs. Use the uninjured leg as a splint for the injured leg. Pass broad bandages under the legs and tie the knots on the uninjured side. In case of sprains, reset the injured limb. Apply ice pack and tie a crepe bandage starting well below the joint and extending above the joint. Elevate the injured limb to prevent from swelling. Head injuries range from bumps and scrapes to scalp lacerations, skull fractures, concussions, and other brain injuries. However, if a person has serious head injury accompanied by loss of consciousness, start with administering DRABC. Administer CPR if the person stops breathing or there is no pulse. Place the head of the casualty on your knees. Place a ring pad on the wound and cover with a cloth. Keep the person lying as quietly as possible without attempting to give any fluids. If a person is conscious, with no signs of fracture, brain or neck injury, but is bleeding from the scalp, this could be a symptom of a mild head injury. Control bleeding by placing clean gauze over the injury and bandage. Make the casualty lie down with the head raised. In case of spinal injury, swiftly immobilize the casualty. Check his breathing and pulse. Support the head and neck at all times by placing hands on both sides of the head. Place padding between the legs to minimize movement. Tie the feet, calves, and thighs with bandages. Place the casualty onto a blanket to transport him to an ambulance. To support the casualty's neck and body, place padding on both sides of the head and in between the arms. One can use a cervical collar, if available, to minimize neck movement.
Party ready? Position. Up.
Shock is a condition which occurs when the circulatory system, which distributes blood to the different organs of the body, fails. It could be due to burns or injury. Lay the casualty down on a blanket. Raise the legs to improve the blood circulation and straighten the arms next to the victim's body. Check breathing of the casualty. Keep the casualty warm by covering the body and legs with a blanket. Moisten the casualty's lips but do not give anything to drink. Call an ambulance. Monitor and record vital signs such as level of response, pulse and breathing. Burns could be minor first-degree burns, second-degree burns or third-degree burns. In first-degree burns, the outer layer of the skin is red and tender, and there may be swelling without blistering. It is generally not considered serious. In such cases, you must flush the burnt area with cool water from a tap or apply cool, wet compresses to the skin. Second-degree burns involve both the epidermis and the underlying dermis. In addition to redness, tenderness and pain, blistering occurs. These burns are not serious unless it is over a large area or any infection takes place. In this scenario, a volunteer must rinse the burnt area with cool water and cover it with a sterile dressing. Third-degree burns involve destruction of all the layers of the skin, including the underlying tissues. In this case, skin may be blackened or white, and there often is no pain because the nerves have been destroyed. This needs immediate medical help. In case of a heat stroke, carry the victim to a cool place with ventilation.
Ready? Yes. Up. Advance.
Yes, buddy. Yes, good.
Loosen the tight clothing if necessary. Cover the victim with a wet sheet to lower the temperature. Wipe him with a wet cloth or sponge soaked in cold water. If the victim is conscious, give fluids like glucose water, ORS mixed in water, or simple salt water. Seek medical help if the victim vomits and shows no sign of recovery. In case a person gets bitten by a snake, immediately locate the bitten area. Raise the victim's head. Clean the stung area with clean water. Do not let the victim fall asleep. Tie a tight bandage above the sting mark. Place a padding between the legs and immobilize the legs by tying bandages. Do not suck the poison, but immediately send for medical aid for appropriate anti-snake venom treatment. During floods, a lot of lives are lost due to drowning. In case a person is drowning, approach the victim carefully from behind. Grab the clothing of the victim from the back and pull the victim towards the shore. Tell the victim to extend his arms away from you. If the victim is breathing, place him in the recovery position. Cover the victim with something warm to prevent hypothermia. Every volunteer trained in first aid techniques should always be ready with a first aid kit consisting of essential items. The kit includes triangular bandages, roller bandages, sterile gauze, plaster strip dressing, adhesive tape, sterile non-adhesive pads, sterile eye pads, eye wash container, adhesive wound dressing, antiseptic solution, safety pins, scissors, splinter forceps, disposable gloves, thermometer, torch and batteries, matchbox, accident register and pencil, first aid manual, medically prescribed antiseptic solutions, cream, tablets, and oral rehydration solution ORS, and a card listing contact details of local emergency medical centers, trauma centers, and ambulance services.